questions if people get on?
I don't think we'll be able to.
Okay,
That's
okay.
That's all right.
Yeah.
Okay. All right, we're live. Hi, I'm Yen Shipley, and I am here with my wonderful colleagues for Ladypod Live. We are 4 orthopedic surgeons and moms, and we're going to be telling you a little bit about our experiences. So we have Dr. Pamela Mehta, and we have Dr. Karen Sutton, and we have Dr. Jennifer Weiss, and I'm Yen Shipley. So why don't you start and tell us a little bit about yourself?
Okay, so
Yeah.
So Pamela Mehta, and I am a board certified orthopedic surgeon in the Bay Area. I have a solo private practice. I trained at Columbia. I did not do a fellowship, so I'm a general orthopedic surgeon. And I work full-time there at my private practice that I started. And I have 2 kids with 1 on the way. My husband is an ortho spine surgeon, so between the 2 of us, we have a little bit of a crazy life where we just have to do a lot of time management and try to figure out how to manage our schedules and be there for our kids, obviously. And I think just with the kind of the right amount of balance and just working towards that together and a lot of communication, we're able to achieve that. So that's a little bit about me.
Yeah, and so I am an orthopedic surgeon with a sports medicine specialty. I practice in Portland, Oregon, and I'm in private practice. I'm obsessed with my family. We get to take advantage of all the outdoorsy stuff. We're a skiing family, or technically I'm a snowboarder, but the rest of the family skis. And I love paddleboarding in our rivers and lakes, and just trying to take advantage of everything Portland has to offer.
And I'm Karen Sutton. I'm an orthopedic surgeon at Hospital for Special Surgery, and I specialize in sports medicine. So I'm at an academic institution. I take care of the U.S. lacrosse team as well as the U.S. ski and snowboard team. And then I'm the chief medical officer for the Federation of International Lacrosse. So if anybody wants to know about covering sports teams, I can help with that. And then I'm a mom of 4 children, 3 boys and a little daughter. We call her the sporty princess.
I love that.
She's tough, but she also likes to dress in pink and princess dresses.
Perfect.
And I definitely have an interest in encouraging female athletes to do performance training, and I enjoy that myself. So I do a lot of strength training and do triathlons in my all that spare time that I have.
Right.
And I'm Jennifer Weiss. I am a pediatric orthopedist who specializes in sports. So I'm as niched and ridiculous as you can get. And I am super impressed, actually, that you haven't done a fellowship, because that is an amazing sort of lost art, quite frankly. So I love that. I practice at Kaiser Permanente in Los Angeles, California. I have 3 children, 2 girls and a boy. My middle child is my spirit animal. Her name is Coco. She insists that I mention her whenever anybody interviews me. So you're welcome, Coco. And I am not here today representing my role at Kaiser Permanente or my role in the Orthopedic Academy, but I will tell you what it is, which is that I work with the communication. I lead the communications cabinet for our Orthopedic Academy, so I'm hoping to give some pearls about some programs that may be related to that.
That's great. Awesome. Why don't you go ahead and just jump into how and why you're an orthopedic surgeon?
Yeah, I love that I'm feeling grandma-like right now. I've seen these women grow up and just like watching them proudly from afar. So when I was in kindergarten, you go around the room, what are you gonna do when you grow up? It's like, I'm going to be a ballerina and I'm going to be an orthopedic surgeon. And and actually
an ankle problem.
Correct. Yeah. And I now understand that there are some of you out there that are both of those things. So I love that. You can't see now, but I'm like 6 feet tall. I wasn't going to be a ballerina. I ended up being an orthopedic surgeon. My dad, the short answer is my dad was an orthopedic surgeon. He was very influential.
That's great.
So I became an orthopedic surgeon through playing a lot of sports. I played lacrosse in college. I went to Duke and started getting a network with orthopedic surgeons at Duke. So there was a class at Duke that was anatomy of the lower extremity, which happened to be a lot of athletes would take it, and the professors there really encouraged us to look at least at orthopedic surgery, and they would give us a little bit of a day in the life of an orthopedic surgeon. So I think that helped to just delve into orthopedics and understand what somebody does on an hour by hour basis, rather than just say, oh, that global picture of being an orthopedic surgeon looks so cool. So we had that firsthand knowledge. And then I did have mentors growing up. My father was a cardiologist, so at least I knew the world of medicine, which helped. He didn't understand why I wanted to be a carpenter and a surgeon and not a cardiologist, which he thought was a little bit more intellectual, but I beg to differ. And so that was my initial push into orthopedics.
Yeah. I actually did not even know what orthopedics was. Even as I started medical school, I thought I was going to be an internist or a generalist, and it became just very clear very quickly. And I'm sure you ladies can relate too. You know, you start medical school and you realize, okay, I'm a surgical person, I'm non-surgical, and I very much clearly was headed in that direction. I wasn't exposed to orthopedics until I shadowed a family friend. I'm the first physician in my family, and so I didn't have anyone to kind of be able to get that experience from within the family. But I shadowed a family friend, and he was a total joint person, and I got to do a longitudinal shadow in which I got to see the pre-ops and the post-ops and surgery, and I got to see the post-op total hip walk into the clinic a week later after I saw this person like filleted open. And I was blown away. And even though I don't do hips and knees as far as it's influential for me, just kind of the ability to change a person's function in such a dramatic way. It just highlighted what we can accomplish as orthopedic surgeons, but B, also just how amazing the human body is and how resilient it is. So that's how I ended up going into ortho.
I love how all your stories are so different. And mine's kind of different too, because I'm in the company of athletes over here. And you know, the prototypical, stereotypical orthopedic surgeon is an athlete or jockey. I was not at all. I mean, I like to work out, but I'm kind of klutz actually. But so when I went to medical school, I also thought I was going to do something in primary care, maybe OB-GYN as something in surgery. But my first rotation was trauma surgery. I wanted to get it out of the way because I wanted nothing to do with surgery. And I just, within the first day, was in love with it. I was like, how awesome is this? You can go and fix someone in the OR and then they're better. And so that just changed my entire trajectory. And I knew I wanted to be a surgeon at that point. And quite honestly, I thought ortho was fun. I thought the people were fun. I thought the procedures were fun. I liked doing small surgeries and big open surgeries. And that's sort of how I chose. It might have been naive at the time because I don't know that I knew much more than that, but that's how I kind of became an orthopedic surgeon.
I think one good point that you made is when you're looking at these fields too, it's important to see who's in them. Mm-hmm. You know, I think you can check the boxes and say, oh, I like engineering, I like putting things back together, I like construction work, but until, just as you mentioned, the people are fine, you really connected with them. I think that's a great observation, you know, because each specialty, each subspecialty has a bit of their own personality. I don't want to make a huge generalization, but see how you work with them and see if you really feel like that's the life that you want to lead.
Right. Like if you can walk into, as a med student, you can walk into a rotation. And for me, for example, when I started my ortho rotation, I was like, these are my people, yeah. You know? And so I was like, this is clearly where I belong. Yeah. So it just reinforced my decision.
And Jen was actually a fellow, right? A fellow when I was a medical student.
Yeah.
And I was at USC and she was at the Children's Hospital. Yeah. And the USC guys were fun. They worked hard and they played hard. And that was kind of my mentality. Mm-hmm. And then I met Jen and I was like, oh, and there's a female too. And, you know, she was amazing. And then it's only been many years later, you know, when we've gotten to reconnect. But it's crazy how much influence your school and kind of like the people that you meet have on what you decide to go into.
Right. And I'll just add, there may be some people watching that maybe are not familiar with just kind of the steps to get here. And so when we say fellow, maybe I'll go back. So you go to medical school, right? There's 4 years of medical school. And then orthopedic residency is after you get your MD, it's 5 years. And then a fellowship is sometimes 2 years, right? For tumor It's 2 years that you do after your residency if you want to subspecialize. And so like Pamela was saying earlier, she opted not to do a fellowship, but she does general orthopedics and has her niche doing that. But so when we say a fellow, clearly she's not a fellow, she's a woman that was a fellow, right?
Yeah.
So that sometimes I think to the general public is a little bit confusing sometimes.
The other thing that I think that you brought up indirectly is, although there's a culture of orthopedic surgery, there can be microcultures. So for example, I am a pediatric orthopedist, and we haven't mentioned yet, and we always have to in our conversation, right? 6% of the orthopedic surgeons that are board certified in this country at this time are women. Pediatric orthopedics is much larger percent of women. So it's a different microculture.
Absolutely.
For sure. So another thing that we wanted to talk about is just our individual experiences with being moms or becoming moms, because that's kind of a hot topic. And I think a lot of female medical students who express interest in going into surgical fields are often turned away, or not turned away, but like they're discouraged. Yeah, exactly. They're discouraged. You're like, oh, you're never going to be a mom and be a good surgeon. And I think, and I think that's false. And we're all good examples of how we're orthopedic surgeons and we're moms and we make it work. So
were you guys ever discouraged from
did anyone ever tell you not to go into orthopedic surgery?
Go into MR, or which there's nothing wrong with that field, but it's not orthopedic surgery. And I was told to go into anesthesia. Oh, if you like the OR, go into anesthesia. It's a better life. I was told that I wouldn't be able to work part-time as an orthopedic surgeon. I wouldn't be able to have, it'd be harder to get married and have kids. Which I think there's some truth to, like when you do a surgical residency, it's a little bit more grueling. So your personal life may, take a hold or, backseat, but I do think it's absolutely possible. I don't know if any of you guys had children in training.
I was told during fellowship that I should not have a child during fellowship. So as I accepted my fellowship, one of the doctors who wrote my letters of recommendation, he said, now don't get pregnant during that fellowship. And, at that point I was 33 and knew I wanted to have more than one child. And I didn't know if it was going to be challenging. And I remember reading an article, I think it was in Time magazine years and years ago, by CEOs of companies. And they said the biggest advice they would give to younger women would be, there's no good time to have a child. So if you feel like the time is right at that point, you'll work it out between your co-residents. And so I had my first child right at the end of fellowship.
Okay.
Was it in between fellowship and starting your job?
Yes. I had, Luke was my oldest, he's 9 now. I had him, fellowship ended in August, and I had him in November. And I took that time, I actually shadowed Dr. Coker up at Boston Children's for those 3 months to make a really amazing time out of those 3 months before I had Luke. And it was great. I learned a lot through that program.
So when did you start your job then?
Then I started my job 10 weeks after that. Each of my maternity leaves were about 10 weeks.
Okay.
Yeah, so I learned a fun fact recently. I'm working with Selena Poon on a paper about women having babies as orthopedic surgeons. So if you have a baby during residency, the cost, like the financial opportunity cost, is about $150. That doesn't speak to all the other costs. If you have a baby, if you are in practice, the financial implication per baby is upwards of $40,000. And that's opportunity costs of overhead and things like that. So there's not a good time.
Right. There's never really a
that was
good
an
time.
interesting fact. That's new.
So I'll share not such a great story. I was single all through residency, so I guess I could have had the opportunity to have a kid, but I wanted to do it with a partner. So I got married right after residency, and we wanted to have kids because I was also around 33, and I thought, okay, kind of the clock is ticking. And so at that point, I was part of a group that didn't take so well to me getting pregnant in my first year of being an attending. And so they made it very difficult. And when my child was 6 months old, I got pregnant again. and they really did not like that. And so that job ended, and I left on my own volition, but they essentially tried to push me out, and so it was very difficult. So I have no good advice of when to have a child, because I look at my co-residents that had children in residency, and I don't know how they did it, because they had to take care of themselves and a family. I could barely take care of myself. And when you're a brand new attending is likely the time you're going to be of childbearing age, and you're just starting your career. And believe it or not, being a first few years in attending is harder than residency in a lot of ways. So that's hard to do. And so I almost feel like me and my husband are having a third child, or I am having this child because I wanted the opportunity to have a baby on my own terms. And so now I have my own private practice that I've had for the last 3 years. And so I feel like I can finally enjoy this pregnancy and having the baby and having a maternity leave, not stressed out about what my partners are going to think or trying, And so, I mean, I think there is a happy story at the end of it, but it was very, very tough.
Mm-hmm. The bravery that you display by sharing that story with all of us. I know you're also a mentor to many people who know you even only virtually, and people reach out to you all the time because you are so brave and transparent about that. And you're helping a lot of people by doing that.
Yeah, we have to share the good and the bad, because we're all really happy with our careers and our families, but it hasn't all been easy and rainbows and butterflies. So
I think it is helpful to find a place where they're female surgeon to see what the maternity leave policies are. There are a lot of women that go in and they're pregnant and they ask what the maternity leave policy is, and
nobody knows.
No maternity leave policy.
They've never had to think about it.
And so I had a colleague, the other women orthopedic surgeon before I started, she had twins, and so she was trying to figure out what the policy was with that, because she had some concerns before delivering, so she wanted to take some time to protect the children during that time. And then for me, I had a preemie who was born 10 weeks early as my third, and so he was in the NICU for 51 days.
Wow.
And so do I take my maternity leave when he's in the NICU, but then when he comes home, I wanted to spend time with him. So I actually went back to work 3 days after giving birth, because I'm like, I don't know what the policy is, so I'm going to be out here. And I had wonderful colleagues, and they're like, go home. What are you doing? Just go home. We'll figure this out. And so I took the majority of my maternity leave when he came home. So I would go into work, whether it was a half day, 3/4 day. My colleagues, again, were very supportive, because I was a real hard worker going into it, and they knew that, and they knew I wasn't trying to manipulate any type of system. But every situation is different, and you need to be able to discuss that with your colleagues. So you need to have colleagues that respect you, that potentially there may have been 1 or 2 women before you. I think that's really helpful.
That is an excellent point, because what I'll segue into is, before I had my children, I had the notion that this was not going to go well. They asked me in my interview, which is illegal, are you going to have children? And then they shut the door and they said the department is worried about a pregnancy. And I was honest. I'm like,
illegal, totally illegal.
But I was like, I just got married. I am going to have a baby. But that should have been my indication to run, away from that job. But and as we all probably have been in our life, we feel like, oh, I'll work hard and it'll be fine. We're all used to doing that. I can still, make it. They're just going to get to know me and know that I have good work ethic. But, like you said, you have to kind of ask those questions and know what you're getting yourself into.
Right.
Other females there are certainly helpful, or just kind of, you can tell if there's going to be a supportive environment. So that's a mistake I made. I should have known that this was not going to be the right way. And I think that's part of,
living and learning.
Yeah, exactly.
Yeah. I had mine very shortly after starting my job. But it worked out, because I went into private practice. I negotiated my contract such that I built in the ability to have maternity leave, because it wasn't there. There was nothing written in there. And so for those of you who maybe are already in residency and you're finishing up, just contract negotiations, they'll hand you something. You can always negotiate that. But I took kind of a funky path to medicine, in that I took 6 years off. And so I was already like kind of geriatric starting medical school. And so thus I had a geriatric pregnancy, you know, and so, and I didn't marry until halfway through residency. So there was no consideration for having a child early in residency or even in med school, you know, that it's just how it worked out. And so, by the time I was funny in that I thought, I don't want kids. I can barely take care of myself. I didn't think I wanted to have a child. And then all of a sudden we got married and I still was like, kind of like, I don't want children. And then all of a sudden one day I was like, oh my God, I'm in my late 30s and I need to have a child. And so by then, you know, I was quite a bit older. And so one of the things that I would say is yes, there's not an easy time. And there's never really a great time, but you figure it out. And fertility is a real thing.
It's a real thing.
And it goes away. And so, you know, we had to use fertility to have my one son. And so, and that was a consequence of circumstance plus choice together. But, you know, I think in talking to younger women, they're, you know, as much as you work out and feel good and feel young, and your body's still, it's listening to that clock, you know? So, yeah. Any pearls of wisdom from your end?
Don't go into labor on a plane. I did with my third child.
Oh my goodness.
That's gotta be a good story.
Yeah. So yes, what I would say is there's never a good time, but there shouldn't ever be a bad time either. And I think pediatric said it. I choose joy now. She apparently had some time where she didn't, and I think I'm a huge pessimist about a lot of things, but about this, I will say you got to go with your gut and find people who are going to support you on it.
Yeah,
and look out for you and your family and what it needs the most.
Yes, because at the end of the day,
yeah,
that's what you have, right?
It's better to change jobs than change families.
Yes, that is a very good point.
That's true.
Just what I did. Change jobs.
Good job. Well, one of the things we wanted to kind of wrap up with is if there are women or people out there listening that want to go into orthopedic surgery, what are some actionable things that they can do now or in the near future to kind of end up here?
Yeah, I'm going to start with two kind of official shout outs to two programs that are for high school students, or the first is for high school students, and it's called the Perry Initiative. Do we have an ability to make links?
I will put a whole bunch of links in the comments. Yeah,
so we'll put a link to that. Yeah, and that's an amazing program. That's for high school girls. And then there's a program for women and students of underrepresented minorities in medical schools, and it's called Nth Dimension. We'll put a link to that, and it's run by a woman named Bonnie Simpson Mason, who is trained as an orthopedic surgeon and stopped practicing orthopedic surgery due to medical problems, and she has become a queen of our field in giving us such wonderful pipeline to wonderful people.
I think from my perspective, being at an academic institution, there are a lot of places that will have summer internships. I think that's nice because it's a very organized method to see other orthopedic surgeons, to hopefully potentially get research projects, as well as to just get your hands in the operating room and see what goes on there. I think it's really important to have that real world experience, but I think you need to have something tangible. So I think shadowing is great, but it'd be nice at the end of it to have a research project, to have a presentation, even if it's something small. You could even present to that smaller group that you're doing the internship with, but try to come up with it with something that you can put on your resume.
I think that's really good advice. And, you know, and you mentioned shadowing. I think that's also, in addition to more organized programs like this, a great way to kind of just dip your feet and get a little bit of the taste of what being in orthopedics is like. And so I mentioned earlier that was influential in me having my very first exposure as a medical student. I wouldn't wait until you're a medical student to do that. I think even in high school or college, if you are curious about this field or any surgical field or any medical field, there are ways to spend time both in the OR and in the clinic with a physician. Even if you don't have any connections within your family, like you can ask your doctor, hey, do you know anybody who you refer to for orthopedics that might, not mind? And you would be really surprised how generous and nice people are with their time when they have somebody who is interested in what they do. So that's my advice.
This is all great ideas. I am a non-academic person. I didn't do much research. I'm really bad at it. I'll let people like you do it who are good at it. And I didn't do a fellowship, so clearly I was not for the academic world. So for me, I think, obviously get your good grades and your test scores, but for me, it was a lot about getting good mentors and networking, and doing a lot of, when the time came, a lot of away rotations. So my whole thing was to put my face in front of people so that they knew that I worked hard and that I would be a good resident and I was easy to work with and I was smart. And so once I did that with a few people, they wrote me some good letters, and then I did some away rotations, and that kind of helped me solidify and get to where I wanted to go. And even, I'll tell you, even in residency, going to Columbia, which is very academic, my program director and chairman super supportive of me, but a lot of people were concerned that I wasn't doing a fellowship, because nowadays everyone does, a lot of people do fellowships. But I got to tell you, it was the best decision for me because I really just do enjoy general orthopedics. So I think the overall message I have is follow your passions and your heart and what it is that you want to do, and you can make the rest work. We talk a lot about balancing family and being a surgeon, and it can be done. I mean, we're not all, at the hospital till the wee hours. We have really good family lives, and you can work part-time as a surgeon, turns out, actually, if that's what you choose to do. You will just make sacrifices another way. Maybe you won't make as much money. Maybe, you won't have as many patients.
So we will definitely post links, the links that you mentioned, and also how to find each of us on the internet in various places. So I'll make sure to put that down into the comments. But if you guys would just real quickly say, hey, you can find me wherever, let's go around and do that.
So my handle on Instagram and Twitter is My Mom the Surgeon, and my website is jenniferweissmd.com.
My handles on Twitter and Instagram are at Karen Sutton MD, and my website is karensutton.com.
My handles on Instagram and Twitter are _NancyMD, and my website is www.nancymd.com. And this is my YouTube channel.
My Instagram handle is dr.Pamela Mehta, and my website is resilienceorthopedics.com.
All right. Thank you, ladies.
Thank you guys. It was fun.
Thank you.
Thanks
Thanks for tuning in.
Bye.
Bye.